Hepatitis D, also referred to as delta hepatitis, is a parenterally transmitted infection that can only occur in the presence of hepatitis B. The replication and expression of HDV are dependent on HBV. The only member of the delta virus genus, HDV, is composed of a circular RNA genome and a single structural protein known as hepatitis delta antigen within its core, surrounded by an HBV-derived envelope containing hepatitis antigen. The geographical distribution, pathogenicity, and treatment response of the 8 identified HDV genotypes differ. Like HBV, HDV can be spread sexually through sperm or vaginal secretions, through the blood through intravenous drug use, needle sticks, or blood transfusions, or from mother to child during pregnancy. The serological tests used are IgM anti-HDV and IgG anti-HDV for screening tests, wherein IgM anti-HDV is produced during acute hepatitis D infections. Its onset may be delayed, its duration may be brief, and it may be ignored. IgM antibodies specific to HDV can persist throughout chronic infection. Furthermore, it is enhanced in response to HDV-induced damage and therefore serves as a good surrogate measure for liver damage immunopathologically associated with HDV infection. In addition to giving diagnostic information, serum IgM anti-HDV is the strongest predictor of impending remission of spontaneous or interferon-induced chronic HDV disease. While IgG and anti-HDV radioimmunoassay or enzyme immunoassay kits detect IgG antibodies against HDV. Enzyme immunoassay kits employ a competitive test format in which unlabeled anti-delta antibodies from patient serum compete with a consistent amount of human anti-delta labeled IgG for a restricted number of HDV antigen binding sites. Moreover, the proportion of labeled anti-HDV bound to solid phase is inversely proportional to the anti-delta concentration in the test sample. Therefore, it indicates exposure to the virus and may imply an acute, chronic, or prior infection with hepatitis D. Lastly is the HDV RNA, which is used for screening tests. It is used if the HDV total antibody test is positive. The HDV RNA test should be performed to confirm an active infection. If this test is negative, it is unlikely that an infection is present. Therefore, HDV infection can be diagnosed through the detection of this serum. The principles of the serological test indicate that IgM anti-HDV hepatitis delta virus specific antibodies are identified via a competitive immunoassay in which they compete with virus-specific polyclonal IgG antibody labeled with horseradish berry oxidase for a defined amount of recombinant HDV protein coated in microplate wells, and that the HDV RNA quantitative real-time PCR can be used to aid in the diagnosis and monitoring of HDV infection and treatment. The detection of HDV RNA in the serum is evident that viral replication has occurred in the liver.